In Dallas, Texas, meet David, a former corporate vice president.
You're a professional man, Mr. Respectability. Would a woman dating you have any idea that they might contract AIDS unless you told them?
No. There's no way she could know. There's no way that she would know that I was an IV drug user unless I told her.
In Seattle, Washington, meet Mayor and Betty.
Had you not been tested, is there any way a man going out with you on a date would know that he was at risk?
No one knows unless I have told them that I'm carrying the AIDS virus.
Didn't it occur to you that you were vulnerable?
No, it didn't occur to me because it couldn't happen to me. That's just, I wasn't an IV drug user, and it just was something that...
But David was, and you knew it.
But he was so healthy.
Mayor is 29 and the mother of 2. A few years ago, her sister Betty, also the mother of 2, had a relationship with David. David had used IV drugs for years, but had stopped by the time Betty met him. They dated for about a year, and then 2 years ago, Betty introduced David to her sister Mayor. Today, Mayor, Betty, and David all suffer from the AIDS virus. They assume David got the AIDS virus by sharing IV needles and then passed the virus sexually to each of the young women. This is how AIDS spreads among IV drug users. After an infected user shoots up, drops of his blood, which carry the AIDS virus, remain in the needle. The needle is then ready to infect the next user. Dozens of addicts may share the same needle. Once infected, those users can then spread the disease sexually. Mayor is so sick, she's now on welfare. Betty, an office worker who chose to remain anonymous, says she has a new symptom every month.
Even though they were saying, well, this is on its way into the heterosexual community, that somehow didn't mean me.
Across the nation, in Brooklyn, New York, Yolanda Serrano and Alan Marshall took me to a shooting gallery, an abandoned building where addicts can go undetected to get and shoot the drugs they need.
You have to use bleach to sterilize the set of works.
Armed with information, the best weapon against AIDS we have, they're determined to keep addicts from spreading the virus among themselves and their sexual partners.
I was told that I'm still at a risk of catching AIDS, even though I stopped shooting drugs.
We found these people knew little about AIDS, but were grateful for the information. Almost everyone knew someone who had died from the disease.
I've had 3 friends that died already.
Rhea died?
I've died from AIDS.
They explained how regular household bleach will disinfect needles.
It's best to draw up the bleach and a mixture of bleach and water in the syringe 3 or 4 times and squirt it out and repeat this process 2 to 3 or 4 times.
Disease is rampant here. This young man we found has open lesions which won't heal. He doesn't know if he has AIDS or not.
You need to go to the nearest emergency room.
You should get medical help. How bad is the problem of their spreading it?
Very bad, very bad. I mean, right now we're very concerned with the children who are being born with AIDS. Most are children of IV drug users. We're concerned with the women, sexual partners of the IV drug users. IV drug abusing men, most of them have girlfriends and wives who are not IV drug users, and these women are at terrible risk for AIDS. Well, let me show you how to use this condom, okay?
She explains how condoms used with spermicide will keep the virus from spreading sexually.
The well is known with the well.
The addicts are concerned. They have questions.
With the sperm, the woman will bust that out?
No.
Because it looks kind of thin, isn't it?
No, it's not very thin. It stretches and it takes out a lot of abuse, and you see it not breaking, okay? And it really is a barrier against the AIDS virus.
Yolanda reaches them the hard way, on the streets. But her goal is to get them off the streets and into treatment to cure their addiction.
Okay, if you call this number here, I will get you in a program.
The goal is to try to help the addict in the street until they can get into treatment. Once in treatment, the treatment system has to work with them to get them to appreciate their risk of AIDS.
Dr. Stephen Margolis is an AIDS and addiction specialist. He says AIDS and sex education need to be included at the nation's hundreds of drug rehab centers. These centers reach thousands of addicts, potential captive audiences for AIDS education.
Well, in theory, it sounds simple enough, but in reality, look what we find. At the rehab centers where you've gone, have you been told how to protect yourself, how to protect your wife, how to keep from spreading the disease?
No, none of them.
Unfortunately, AIDS information may be the exception rather than the rule in drug therapy programs, and the reasons are complicated. Some administrators believe treating addicts is difficult enough without introducing AIDS into the picture. Others, like Dr. Charles Ferris, argue AIDS is already in the picture and must be dealt with.
It would help if we jerked our head out of the sand and say, look, here's what part of the territory is like if you're treating drug and alcoholism victims. They have AIDS. They have AIDS on a regular basis.
Can you accept a person there with AIDS? You can't.
From telephone interviews across the country, 2020 has discovered that some treatment centers won't even take clients who test positive for the AIDS virus. When a program does accept a client, often no AIDS education is provided, and the issue of AIDS can be clumsily handled.
Hello, my name is John Hannon. I'm with Positive AIDS in Recovery.
John Hannon, a recovering addict and AIDS activist, claims he didn't receive appropriate care at the Baylor Adult Care Unit in Dallas, Texas. Drug rehab therapy is usually based on openness and group support. But when John tested positive for the AIDS virus, he says he was told to keep it quiet.
Well, how did you feel? Did that pose a dilemma for you?
Made me angry, real angry. I was in a therapeutic environment that stressed group therapy, and all of a sudden I'm told not to talk about it.
Dr. Robert Gehring, the unit's medical director, advised John to clam up. From a previous experience where threats were made, Gehring was concerned about how John's diagnosis would be received by the other patients.
If a patient goes to a support group and says, I'm HIV positive, and they physically harm that patient, if they throw him out physically and make death threats against him, is that therapeutic?
This person went on to say no one ever counseled him or educated him or briefed him about what life would be like and what he should expect.
We have to concentrate on the reason that he's here. The reason that he's here is his drug addiction. Secondarily, he's here to find support for AIDS.
Within the unit, John decided to speak out anyway.
Deep down, I knew that that was not going to work for me, so I brought materials in from the outside. I brought in information about AIDS. I put it on the bulletin boards. I started talking about it. The information on the bulletin boards was taken down almost immediately upon my putting it up.
Dr. Ferris, who was a counselor at Baylor at the time, says had the unit faced the issue of AIDS head-on instead of ignoring it, such problems could have been avoided.
It's a seriously, easily preventable disease with just a modicum of direct, straightforward education.
Ferris is especially worried about patients when they leave treatment.
Many of these people are passing on the disease without even knowing it, simply because in the treatment facility we were too afraid to talk about sexuality issues.
Although changes have now been made at Baylor, a communications gap can be a serious obstacle in a drug treatment center. However, we found one place that's overcome that.
Do I look like I'm infected with the virus, ladies? Yeah, and with the men, you know, if you look at a lady who has a virus, I mean, until they're in the latter stages, you really can't tell.
Richard Carper and his wife Debbie were both IV drug users who learned nothing about AIDS when they were in rehab. When they found they were infected with the AIDS virus, they began speaking out to warn other addicts. This day was spent at the Stump Ranch, a therapeutic community outside Eugene, Oregon, where residents may spend months in self-help rehabilitation.
I'm Chuck. I'm an addict. I'm an alcoholic.
Hi, Chuck.
Chuck is at double risk of getting AIDS.
Yeah, I've used the services of prostitutes several times. And a lot of experimentation with a lot of different women who prostitute themselves, not so much for money, but for drugs. And I think that's real prevalent in IV drug use. Whoever had the drugs then had the women. And so it's conceivable there's hundreds and hundreds and hundreds of different exposures, and that bothers me.
Remember, many addicts support their habit by prostitution. Their customers can take the disease home to their wives, just like syphilis or gonorrhea.
You need to talk safe sex. We need to talk about needle usage. We need to talk about condoms.
The Stump Ranch has AIDS education, but what they don't have is money. As a small nonprofit organization, they don't get the big bucks from insurance claims the large profit-making facilities like Baylor routinely get. In the numerous small nonprofit programs, they stretch the dollar to the breaking point.
We're asked to house, we're asked to feed, we're asked to teach, we're asked to treat, we're asked to refer, we're asked to educate.
This is the national meeting of the Therapeutic Communities of America. President David Macktus leads this organization of small non-profit drug treatment centers.
And now we're asked to do AIDS education, now we're asked to be experts. All of those services are delivered at the cost on a national average of $40 a day.
It angers me that a country with so much resources can just totally ignore what is happening to a substantial part of its population.
Congressman Charles Rangel chairs the House Narcotics Committee. He's sponsoring a bill to bring an additional $400 million federal dollars directly to drug rehab and prevention programs across the country.
If you're going to deal with AIDS, you cannot run away from the IV drug abuser.
Rangel represents New York City's Harlem. He's especially concerned about AIDS among blacks and Hispanics, who make up almost half of the victims of this epidemic. At growing risk are young inner-city teenagers, like Jane.
Well, at the age of 16, I was dealing with a man, and he was a drug user, which I didn't realize. I didn't know it. And we had intercourse.
Jane was fine for 4 years until
I started getting symptoms. Hot sweats, fevers, loss of appetite, loss of weight, about 17 pounds within a month's time.
Today, Jane is dying of AIDS, infected at the age of 16 by an IV-using boyfriend.
The reality is today, nobody should get that virus. If they're appropriately educated and informed, take appropriate actions, then they do not have to get this virus.
Until last August, Dr. Margolis had been in charge of AIDS education for IV drug users at the Centers for Disease Control. He quit his post frustrated with what he felt was the Reagan administration's lack of concern and leadership about AIDS.
There have to be dollars and there has to be coordination of effort. That's what we're not seeing.
The number of addicts infected with the AIDS virus skyrocketed from a few thousand in 1979 to nearly 250,000 today. Yet from 1979 to 1986, federal funds for drug prevention and rehabilitation shrank by an estimated 20%. In 1987, emergency funds were appropriated by Congress. Some of that money is now available for AIDS information, but critics say not nearly enough.
Someone has to appreciate we're fighting a war. And to fight a war, you have to have an army.
Unless that commitment comes with funding and education, those closest to the problem agree. The vicious cycle of ignorance and infection will continue.
I have an 18-year-old son who is sexually active. I've told him everything I have learned and showed him every pamphlet I have been able to pick up about safe sex. And I told him that if I'm an attractive, young-looking woman. If I have AIDS, then there can be a lot of cute little girls out there who have it too.